Recording in progress.
Hello, can anyone hear me? Okay. Thank you for the opportunity to give a talk on the annual LPHYS physics workshop. And let me present our research on laser radiation at 1265 nanometers decreases microRNA expression in murine melanoma cells. One of the important fields in cancer prevention and treatment is study of new molecular targets such as microRNAs which perform multiple functions inside the cell or the whole organism. Altered cell gene expression provides the opportunity to find specific microRNAs and adapt these as molecular targets for others with different parameters and genes. MicroRNAs are small single-stranded non-coding RNA molecules containing from 18 to 25 nucleotides. These molecules are involved in RNA silencing, also known as negative RNA expression, and post-transcriptional regulation of gene expression. The laser radiation at the range of 1264 to 1270 nanometers causes single oxygen generation and modulate vital parameters at the cellular and molecular levels. In our work, we employed a laser diode with Bragg external cavity operating at 1265 nanometers with a line width of 1.5 nanometers. The RAM melanoma cell line was irradiated at the medium growth stage inside the tabletop CO2 incubator. During the experiments, the surface dose of laser radiation had been chosen. Here you can see laser radiation parameters: average power of radiation, time of radiation, area of radiation, intensity of radiation, and energy density. Immediately after radiation, cell RNA was extracted and reverse transcription PCR was performed. Now let me introduce the results. After 1265 nanometer laser radiation exposure, microRNA-21 has negative expression comparing to unirradiated control. You can see it here. This control, this experimental expression level. The most of the targets of MyR21 are tumor suppressors, and it is associated with a variety of cancers such as breast, ovaries, cervix, colon, lung, brain, esophagus, prostate, pancreas, and thyroid. Also, it can serve as a diagnostic or prognostic marker for malignant disease. Expression of microRNA-31 also decreases in experimental group. But for this microRNA, the possibility of direct therapeutic use is not that simple. MicroRNA-31 can not only enhance tumor development and progression in, for example, pancreatic and colorectal cancer, but also inhibit tumorigenesis and induce apoptosis in ovarian and prostate cancer. microRNA 100C expression was inhibited by 1265 nanometers laser irradiation as well. The microRNA 100C plays a vital role in the process of epithelial mesenchymal transition, which is important for embryonic development, cancer, and in some diseases. It is upregulated in such cancers as ovarian cancer, bile duct cancer, nasopharyngeal carcinoma, lung cancer, colorectal cancer, and gastric cancer. And it is downregulated in bladder cancer, spinal cord injury, and breast cancer. So our study has demonstrated that diode laser radiation at 1265 nanometers altered RNA profiles by inhibiting expression of microRNAs 31, 21, and 100C in murine melanoma cells at the energy density of 562.5 millijoules per square centimeter. These results show that 1,260,000 miniaturized can become potential suppressor of MyR21 in solid malignancies. However, the role of MyR31 and 100C in melanoma cancer aren't quite clear, so the further research would shed the light, as we think, on the question if the last expression of these microRNAs will be useful tool for melanoma treatment. Thank you for your attention, and I will be happy to answer your questions.
Allo? C'è nessuno che parla, nessuno che guarda. Hello?
Hello. Hello.
Yes, good morning.
Yes. Yes.
Good morning, Professor Bastianelli. I have my presentation. Could you watch the presentation now?
Yes, it's
The line is not very good. You see my presentation now, Miss?
Yeah, it's better. No.
Okay, now it's better. Okay, now, very good. Thank you very much. Good morning, good afternoon from Ravenna. I'm here with Marco. Good morning. And I'm very proud to present, like every year by many years, my speech about the laser. I used the laser from 1978, so there are very many years now. I've used many types of laser, but mostly of them only in surgery. And now you know better than me that we can start what we call the photobiomodulation. And today I will talk about the photobiomodulation in chronic rhinosinusitis. You know that the World Health Organization has declared the respiratory chronic disorders one of the 4 major health problems worldwide. And the chronic rhinosinusitis care about 30% of general population. And what I've seen in my 45 years of experience, like an otolaryngologist and surgeon in ear, nose, and throat, that the number of patients is constantly increasing. I want to be in 50 minutes. So what is chronic rhinosinusitis? It's inflammatory disease of the paranasal sinuses that normally take more than 12 weeks. And the symptoms are nasal congestion, mucus discharge from the nose or mucus that drips down the back of the throat, the facial pain, and decreased sense of smell. Are you watching my slides, doctor? Doctor? The slides is going on?
Now it is.
Okay, good. Thank you very much. So one of the most important things is the allergy, because I'm also specialist in allergy, and the allergic rhinitis is an inflammatory condition that is really a big problem, because I remember many years ago was normally 10% of population, but now is growing very, very much. And now we consider about 40% of the people as allergic rhinitis. But when you have allergic rhinitis, this, of course, worsen the clinical course of a chronic rhinosinusitis. What we do normally for chronic rhinosinusitis? Normally, we want to restore the normal nose and sinus functioning, enable the patient to achieve normal social function, olfaction, taste, and restful sleep. Normally, there is no gold standard, what we call gold standard in chronic, but normally we treat with antimicrobial and anti-inflammatory drugs, and or at the end of therapy that have no good results, we use the endoscopic sinus surgery. But the endoscopic sinus surgery, sometimes they have a really big side effects like osteoporosis. Now, I'm very proud to present you, because only few studies have examined the effect of low-level laser photobiomodulation on chronic rhinosinusitis, and the laser represent a really non-invasive treatment for chronic rhinosinusitis, having demonstrated to have anti-inflammatory and antibacterial effects. And this you can see the normally very few bibliography, but we have some paper like one of me. Then we have treated 150 Italian patients, mainly females, from 12 years up to 80 years with chronic rhinosinusitis, that they have this problem just 3 months, and we have no results with conventional medical therapy, like antibiotics, like, for example, spray on the nose and aerosol, including, of course, both allergic and non-allergic patients. And all medical therapies for chronic have been interrupted at least 4 weeks before laser treatment. And also the patients that have clear asthma, like many patients, allergic patients they have, has been excluded from the study. So we have also a control study of another 150 Italian patients, including both allergic and non-allergic, treated with what we call the best medical therapy for chronic sinusitis, of course, excluding the people with asthma. Which is the laser protocol? Is diode laser from a very well-known, world well-known industry in Italy, is the Erfurt Trieste, and there is a direct contact of the laser with the nose mucosa. And you can see, just very briefly, the treatment results evaluation. So what are the parameters? First of all, the presence, absence of post-operative inflammation, measured with clinical devices like CT scan, nose endoscopy, rhinomanometry, and nasal cytology. Or also we use what we call S3.1, is world well-known questionnaire about the self-evaluated degree of patients operated, and score we calculate about before and after the treatment of chronic rhinosinusitis. The results are very good, because the patients treated with the LPBM, so the low, of course, therapy, biomodulation, showed a good reduction of nose inflammation with no need of heavy local and general therapy. And these results are very good in allergic and also non-allergic laser-treated patients. And symptom-free follow-up was reported after 1 year. And the data shows significant difference with the S3.22 questionnaire, difference in terms of amelioration and scores of symptoms like nasal obstruction, nasal rhinorrhea, and improving quality of life. The conclusion. First of all, the treatment is safe. Second, is well tolerated and effective on the reduction of symptoms in allergic and non-allergic cases. And the patients treated with these techniques show the better amelioration of allergic symptoms and quality of life, much more than patients that have only pharmacological therapy with no further need of any medical therapy in 1 year follow-up. What we consider, of course, is not the first line treatment, but the low therapy biomodulation is an ancillary therapy of support therapy for high percentage patients and along avoiding long-term therapy with corticosteroids, antibiotics, and vasoconstrictor drug, because the big problem are many patients use the anticonstrictor drugs. Thank you very much for your attention. Vediamo se c'è qualcuno. Doctor, you are present? No. Doctor, you are present?
Yes.
Okay. Have you any question, Dr. Konikova?
Yes. What type of laser do you use? Continuous wave laser or pulse laser?
It's diode laser. It's very simple diode laser. Interesting question, because normally 808, because there is no need to have expensive laser like I use. In this moment, I am in operating room. We finished to do surgery from this morning. Now is 6:25 in Ravenna here. And one of big advantage is to use a very sophisticated laser, but as low power normally. So the parameters are very low. But we can use the same laser in surgery up to 10 watt, 10 WV18.
Okay. So it has heating, yes?
Yes, not so heated, but it is a good question, because normally we have multiple treatment, because in only one treatment you can never have. And one limit is exactly when we have also our parametric, but this is a very good question, because when I use this one, I talk with the patients, and my limit is not so scientific, but it's true, because the tissues have a big variation. So normally we start very low, and we start about with 20 seconds from each nostril. And as soon as the patients start to have feeling of eating, we stop, we wait 10 minutes, and we normally do not do more than 5 treatments every 15 minutes every day. We do normally twice a week for 3 weeks. These are our parameters.
Okay, thank you. That's very interesting.
Thank you very, very much, doctor. Where are you from now? Where are you physically?
I'm from Russia. Yeah.
Yes, but where are you in Russia?
Ульяновsk State University, Middle Volga. So
this is good therapy, doctor, because we consider in your beautiful country, I've had the honor to stay in Kazan in LPHYS' 2000.
yeah,
Yes.
It's close to our city. Yeah.
Okay. Good. Kazan, I have a good remember of a beautiful city with the castle, with the river, and so far. I know very well Russia, and I consider one of the most beautiful country, and of course Russian people. But this is very important also for the countries not very rich in terms of patient, because also in Italy the medicine with the spray and aerosol is very expensive. So you cannot imagine how much they pay to have all time the spray on the nose and all type of the antibiotics all the time. So this is a simple treatment, and the cost when you have a laser is not the fiber you can use several times. There is no problem. So is really one that use the laser with many patients. You divide the price of the laser, you divide for many patients, and the price of treatment is very low, especially if the surgeon or the doctor don't ask too much money. So in terms of comparison, it's quite good.
Yes, I completely agree. This technique is have to be should be cheaper in the future.
Yes, I'm sure. There are some lasers now that you can arrive at a cost of 3,000–4,000 second one. But if you consider how many patients you can treat, because it's not a rare problem that you use only one time in one patient. You have many, 30% of population, many patients come to me and say, there is any alternative of lot of euros in terms of spray or something. And this is a good alternative. The question is another, how long can I have this problem? But we have in 1 year, and many patients say, I'm okay. And if I have some problem after 6 or 1 year more, I can come back to do the same treatment.
Yeah. Do you have any problems with registration of the method?
And say again, registration?
Registration of your approach to treatment.
We normally have done now in this moment we have registered in some conference. We are arriving to publish in the laser medical journal because my co-author is Professor Leonardo Longo, that I'm sure that you know by name, is the new editor about laser medical journal. So in the next 3 months at the end of the year, we will publish. So I'm very proud to say that LPHYS' is the first theater that we can give the results, but they will arrive, of course, on the Laser Medical Journal in the end of the year.
Okay, thank you.
Thank you very much, and goodbye.
Goodbye.
Goodbye.